Good afternoon, conference. My name's Hetal, and I'm the co-chair of Brenton Harrow and also first-time conference speaker. Thank you. With this particular motion, I just want to give some background to how it was all fathomed. So at one of our meetings, we had a committee member mention a case where he'd seen, I think several cases, this is just a better example of it, where he'd taken out a upper right 7654 on a patient that was grossly carious. The patient wanted something fixed in replacement, which as patients would, which is understandable. But he said it wasn't possible, and a denture for him would be the best option at this stage, and then implants long term. 3 months later, the same patient comes back into the practice, has had a bridge placed upper right 8 to upper right 3. Done abroad in his foreign country, and actually the patient's best, or I guess from the patient's point of view, was really thrilled that they only paid £50 for it, more than anything else. Which is worrying in itself, of course. Now, you don't need me to tell you, I'm not a restorative consultant, but the prognosis for that bridge isn't great, ultimately. The upper right 3 was devitalized, and there was secondary caries under the upper right 8 retainer as well. Now, we all know within the NHS service there's limited resources. It's perverse that these scarce resources should be used to rectify mistakes caused by people that have taken treatment against the advice of a dentist in a foreign country where many of these dentists, or all of these dentists, aren't even regulated by the GDC. There is a difference, of course, between those that have moved to the UK and for whom we have to rectify poorly provided care. As healthcare practitioners, that we acknowledge that sometimes we need to deal with it. But specifically against her advice, I think that's a harder thing for us to actually understand, shall we say. Now, we totally understand that it would be very difficult to monitor and uphold who has done what, which is where good note-keeping comes in. But should we be using the NHS as an insurance policy against poorly provided treatment, be it abroad or even privately within the UK? I would urge and call on the conference to support this motion and for GDPC and the BDA to work with the Department of Health and Social Care to devise public messaging to protect our NHS dental service from this abuse. And I do encourage that although there's still some work to be done with this, we should still be having this debate because in the areas that we all work in London anyway, there's a diverse group of population who do go back to their home countries quite often and get a lot of their work done there. And we as practitioners are doing our best, but the funds aren't there. So I urge you to support the motion.
Thank you very much. Right, we have 4 speakers to this motion. Can I ask, I think they are all gentlemen. Gentlemen, if you could be brief, please. So first, Stewart Allen, who is speaking for the motion.
Good afternoon. Stewart Allen, representing West Pennine LDC. Actually, in terms of the proposer, I'm going to be very brief because he's covered a couple of the points that I've already made. The bit I picked up on was errors. I'm very concerned that sometimes we get people who've gone abroad to have treatment. They've had treatment which was not planned in accordance with what we would do in the UK, but doesn't meet the NHS protocols. Then when it's needed maintenance in perhaps 5 or 10 years' time, they've been referred in, and colleagues in secondary care have said, yes, well, now it's in this condition, you must replace that, and you must do it under the health service. So it's not just errors, it's things where the treatment planning doesn't meet our protocols in the first place. Please support the motion.
Thank you very much. Next, we have from Barnet LDC, Alan Ross, who is speaking against the motion.
Alan Ross, Barnet LDC. I really don't like this motion at all. You're undertaking privately within the UK. Well, there's quite often patients who will see dentists privately within the UK. Things don't go quite right, and you end up referring to hospital. Is the hospital then going to turn down seeing the patient? The other thing is that patients very often go abroad for treatment and they come back, things don't work out. I think this is part of our caring profession that the NHS should be seeing these patients. We would probably be the only part of the profession within the NHS associated without not seeing these patients. Medical procedures go wrong abroad and the NHS has to pick up the tab when the patients come home, like it or not. I don't know whether the proposal actually meant general dental services specifically, or whether he meant the entire NHS. But I just don't like the ethos of this proposal. Thank you.
Thank you very much. Right. Next, Peter Totten, Hearts LDC, speaking against the motion.
I actually disagree with the word dental tourism. So if you have a UK resident having private treatment, he's not a tourist. No, he's not a dental tourist. So first of all, I disagree with that. Personal circumstances change throughout life. So if someone is able to afford private dentistry and he has it done, in 20 or 30 years' time, his circumstances changed, he has saved the health service money. All right, he needs to have it rectified now. And how many of you can honestly say that your restorations will last forever? They won't. So I think this is a poor motion. Please don't vote for it.
Thank you very much. And finally, Dan Cook, Gwent LDC, speaking for the motion. Thank you, Dwan.
Good afternoon, everyone. We've had a spate of cases recently of patients going abroad to one particular clinic in Turkey for treatment. Many have come to a number have come to the practice beforehand, discussed it with me, and I said that I don't think there's anything realistically we can offer or the private dentist could offer above and beyond what I've advised due to their periodontal condition, caries rates, medical history, whatever it happens to be. But a number of patients have then come back with treatment, and when I explained to them the problems with it, it was very, very poor quality treatment, they said you would say that. How sad that people feel they can trust these charlatans over us. Something needs to be done about it. I fully understand the way people are uncomfortable about the NHS not helping someone in need. I fully understand that. Whether the wording is right or not, a public information campaign certainly needs to be launched, which is in the details of the motion, but not in the main motion itself. And I also feel that, certainly in terms of the GDS, we shouldn't be carrying the can. It's not the NHS carrying the can for this, it's us in general practice having to deal with this mess. And that's why I think you should vote for the motion.
Thank you very much, Dan. Right, we shall now go to a vote. This is motion number 9. Those in favour, please. Thank you. Those against, please. It's going to be a count, I'm afraid. Sorry. Okay, so we have the count in for motion 9. This was Brenton Harrow LDC. Motion 9, Hetal, has been carried.